Hello students and my dear friends. In this session, we'll discuss one of the important topic, that viral infection, that is hepatitis C virus. If you see the introduction, hepatitis virus, it causes post-transfusion hepatitis in developing countries. So what is mean by post-transfusion hepatitis? So post-transfusion hepatitis, it develops after transmission of contaminated blood as well as the blood products through the contaminated blood transfusions. So why it is considered as post-transfusion hepatitis? So if you see in the year 1990s, so most of the patients they developed hepatitis after the blood transfusion. So there were no proper screening test available in the early 90s. Why? Because the virus itself it was discovered in the year 1989. So that's why it is called as non-A, non-B hepatitis virus. So here hepatitis C virus is considered as non-A, non-B post-transfusion hepatitis virus, whereas hepatitis E virus is also considered as non-A, non-B enteric hepatitis viruses. So this virus, like hepatitis C virus, it belongs to the family of Flaviviridae, and this virus is classified into separate genus that is called as Hepacivirus under the family called Flaviviridae. If you see the morphology, so what is the size of this virus? It is 50 to 60 nanometer in the diameter. So the size of the virus is like 50 to 60 nanometer in the diameter, and they consist of single stranded RNA as genetic material. They consist of single stranded RNA as genetic material with a positive polarity, and they are enclosed in a core. And if you observe, this is the like a core, and this core is surrounded by the like a envelope. So in the picture you can see, so this is the like envelope. So this is a core is surrounded by the like envelope, and the envelope consists of glycoprotein spikes. So these are the glycoprotein spikes. If you see the genetic and antigen diversity, like so this virus, it shows like a high diversity. So it displays like a high diversity in the RNA genome. So why it shows genetic and antigenic diversity? So because of the like a high mutability. So it has higher mutation rate. What is mean by mutation? Which means that is sudden genetic sudden change in the like genetic structure. So because of this diversity, so there is a little heterologous or even homologous post-transfusion post-infection immunity in the hepatitis C infection. So here, so based upon this genetic diversity, so there are like and genetic and antigenic diversity. So there are six different genotypes are there. So these six genotypes are like if you see genotype 1 and genotype 2, they causes most infections. So they are the most common variants in the Western countries. And genotype 3, it is mostly distributed in South and East Asia. Like it has a subtype 3A, so which is most common in the intravenous drug abusers in the Europe. And genotype 4, it is present in North Africa and in Middle East. And genotype 5, it is present in South Africa, and genotype 6, it is present in the Asia. So these are the six different genotypes. And this virus, it cannot be grown in the culture. So it cannot be cultivated in any artificial culture media or any medias. So they can be cloned in the Escherichia coli. So what is the mode of transmission? So what is the mode of transmission here? Like it is mainly transmitted by the needle stick injuries, such as parenteral. So that is the most common route. So here, like it is one of the most common infection which takes place after the like needle stick injuries. So use of contaminated needles, syringes, and contaminated blood products. So if we transfuse like a contaminated blood as well as blood products. So generally, after collection of blood, now we screen for all virals. So if it is not properly screened and if you transfer it to the like a recipient, then recipient will get the like infection. And next, maternal neonatal transmission is also reported, which means vertical transmission from mother to the fetus. So it is very less only, that is only 6% when compared to the hepatitis B virus. So hepatitis B virus has higher rate, that is more around like 20%, but hepatitis C virus is less only, that is 6% only. And sexual intercourse also, so sexual intercourse also rare only. And remember, like hepatitis C virus, it does not spread through the breast milk, food, or even casual contact like shaking hands or hugging or kissing. So that doesn't lead us to the transmission of hepatitis C. And hepatitis C infection, it is seen only in the humans. So humans are only the like reservoirs. So they occurs. This infection occurs throughout the worldwide, and source of infection is large number of carriers. So these are the different modes of transmission of hepatitis C virus you can see in this picture. So such as non-sterile tattooing, like by using of the like needles. So if the needles are contaminated or if they are not sterilized properly, so if they use it for multiple persons, then there are chances of getting infection. And non-sterile dental practices also. So because like either extraction or any procedure like that may cause us the like a hepatitis C virus. And contaminated dialysis equipment. And next, contaminated like drug needles, like intravenous drug abusers. So in case of intravenous drug abusers, there will be like group of people, they will be sharing the like one drug like among themselves. So in that cases also there are chances of infection. And contaminated vaccination equipment, or like non-sterile syringes or needles. And non-sterile body piercing like equipment. So these are also like there are these are the like modes of transmission. So what are the clinical features? So if you see the incubation period, so incubation period is in between like 15 to 160 days. So averagely 50 days. So the patient to develop the like infection like around like within 50 days. So about 75% infections are subclinical. Subclinical means like uh, immediately they may not show the like symptoms. So like the severity of infection will be less, means the symptoms will be less. Uh, Clinical infection is less severe with milder symptoms like absent or less marked jaundice. Either we can see the jaundice. So jaundice, it is characterized by like yellowing of the sclera or like yellowing eyes, skin. Okay, so sometimes we may not see the like jaundice also. And around like 50 to 80 percentage of cases, so they develop the like chronic hepatitis. So the affected individuals, so they have persistence of virus in their blood, so they are at the risk of developing cirrhosis of the liver, which means hardening of the liver, and it leads to the like a hepatocellular carcinoma, which means it leads to the like a liver cancer. So as we discussed in the previous sessions, like hepatitis B and C, they causes cirrhosis as well as the like liver cancer. Next, laboratory diagnosis. So laboratory diagnosis, it is done by detection of anti-HCV antibody. So this is the like a screening test. So here, this is established. So it can be established by detection of anti-HCV, hepatitis C virus antibody. So that can be detected by ELISA. So in the ELISA also, like initially we use first and second generation ELISA. So previously we used to use like first and second generation ELISA. So these first and second generation ELISA, so they were like they can detect only limited HCV antigens for detection of antibodies. So now like we are using the like a third generation ELISA. So it is the standard method for identification of like means for HCV serology. So here it has advantages like increased sensitivity and specificity, and it is not influenced by the HCV genotypes, and it becomes positive in 5 weeks of the infection. And antibody detection, like it is positive after the like 5 weeks of infection. We see the presence of antibody, the specific antibody, it can be due to either acute or chronic infection. And HCV RNA detection, it is done to indicate the like a current infection. So the presence of antibody may be due to acute or chronic infection. So when when ELISA is positive for anti-HCV antibody, so that is confirmed by detecting the hepatitis C viral RNA by RT-PCR, real-time reverse transcriptase polymerase chain reaction. And another method is like RIBA, which means recombinant immunoblot assay. So recombinant immunoblot assay, uh, so we used to do this test in the past uh, to confirm the like a positive results, like after the screening tests are positive. So generally, ELISA is the screening test. So after ELISA is positive, we generally use like RIBA, but now we are not using. So this test, like now we are not using this RIBA method. Next, HCV core antigen assay. So this HCV core antigen assay, it is a automated method. So it is an automated test. So it can detect the like a core antigen of hepatitis C virus. And the advantage is like it can also quantitate the antigen. So it is like an alternative to the like hepatitis C virus RNA detection. ELISA kits, they are like ELISA kits are available for detection of HCV antigen. Next, real-time RT-PCR. So this is confirmatory test. So real-time reverse transcriptase polymerase chain reaction RT-PCR. So this is mainly used for detection of hepatitis C virus RNA. So which is a gold standard method. So it can be detected the like so the RNA can be detected as early as possible, like as early as like 2 to 3 weeks after the like infection. So it is highly sensitive and specific test. So why this method is used? So what are the advantages of this RT-PCR? So it is mainly used to confirm the active hepatitis C virus infection, and by this test we can quantify the like a hepatitis C viral RNA. So this is helpful for mainly monitoring the treatment response, and even we can find out the HCV genotypes. So as we discussed in the previous slides, there are 6 genotypes are there. So we can detect the like a specific genotype. Next, prophylaxis. So general prophylaxis, such as we should screen properly for virals for the blood and the blood products. So whenever we collect the like blood from the donor, so we should screen it properly for virals like either hepatitis B, C, and HIV, and avoidance of use of unsterile needles, syringes, and other materials. Next, treatment. So what is the main aim of treatment? So what is the main aim of treatment? So it is the aim of treatment is to prevent the development of complications. So as we discussed, so this virus causes cirrhosis of liver, which means hardening of the liver, and hepatocellular carcinoma, such as liver cancer. So they causes cirrhosis of liver and hepatocellular carcinoma. So our aim of treatment is like to prevent the like complications, and our aim is to get the sustainable viral response SVR. So what is mean by sustainable viral response? Which means like HCV RNA should be undetectable in the blood. So our aim of treatment is like RNA should not be present in the like blood. Viral RNA should not be present in the blood. So that should be less than 15 international units per ml after the treatment. So to achieve this, we use direct acting antiviral agents such as DAAs. So they are used. This is like a direct and acting antiviral agents. They are the treatment of choice for HCV infection, and by using of these drugs we can achieve like SVR, which means sustainable viral response up to the 90% with minimal adverse effect by using of these drugs. So by without the like side effects, means minimal side effects, so we can achieve the like up to SVR up to the 90%. So we use combination therapy. So combination therapy means we include like different DAS, which means direct acting antiviral agents. So most of the DAS, they are active against to all genotypes. So these drugs, they works on all the genotypes, so which are present in the like a patient. So they mostly like we use like DAS such as sofosbuvir and velpitasvir. Sofosbuvir and velpitasvir. So how long we use these drugs? So minimum for 12 weeks or like 24 weeks. So the duration of this treatment, it depends upon the HCV genotypes and presence or absence of the liver cirrhosis. Thank you.